the Instagram phone. Okay, we are going live. We are going to be on TikTok here. How's my Instagram community doing? And Facebook. Let's get everybody situated. 3, 2, 1. All right, I haven't been live in a bit because I've been traveling like a fool. So I hope you guys have been doing well and everyone has had a good fall break. Are you guys on fall break? I'm not sure. We're going to give this a minute just to allow people to come in. And so excited that now officially my book is out and about. I'm hoping you guys all have a copy or you grabbed a copy and maybe even given it to someone you love. But I wanted to take today to really start our conversations around the hormone shift. This book, first of all, really came about because a lot of my journey into the world of holistic medicine and integrative medicine was accidental. I am a conventionally trained MD, a physician. I've seen a lot of debate about that, by the way, on some of our channels, but just to set the record straight, I am a physician, I'm an MD, and I originally trained and studied and worked actually in pediatrics and emergency medicine. And because of my own health, which was very much rooted in hormone issues and hormone conditions that didn't get picked up until, actually they never got picked up. So I ultimately had to figure it out on my own. I was losing hair, I was having acne, a lot of joint pain. You guys might have heard the story before. But those were the reasons that I really had to ultimately, at the end of the day, figure out what was going on and really try to get the answers for me. So that led to me really learning a lot about hormones, but learning it from more of an Eastern standpoint, right? Because one of my first healers, I always say, was somebody from the world of Chinese medicine. And this particular teacher, mentor, whatever we want to call him, took one look at me and was like, oh my gosh, very bad qi. And I had no idea what he was talking about. And keep in mind, by the way, that this was not at that time a perimenopause or menopause conversation. I was 26, 27 years old. And I didn't know what bad chi meant. I had no idea what he was talking about, but it got me really curious and really interested. And so as I dug deeper into what he was talking about, worked with him to a certain extent, I got introduced to this whole world of Chinese medicine, holistic medicine, and then I dipped my toe into Ayurveda and was shocked by how much these systems of medicine very much stress the importance of gut health, of food, of nutrition, your emotional well-being, and so much more if you're going to have a conversation around hormones. So that was over 20 something years ago. When was it? It was probably 2003, 2004, 2005, right? So we're talking about 20 years ago. And the long story short of that entire experience was that I was able to heal myself. And because I was able to heal myself, everyone around me got really curious. They're like, oh my gosh, what did you do? What changed? What was different? And as people started asking me more and more questions, I realized back then that this was the conversation that people were not having. They didn't have access to this information. And so I throw out a tip here and I throw out a tip there, and someone would tell me it worked or it helped them. And so as this continued, right, like I'm better finally after 2 years of really studying Chinese medicine, Ayurvedic medicine. I did the fellowship in integrative medicine with Dr. Andy Wheel out in Arizona, and that was game changing, by the way. I became a certified nutrition specialist as well. So I had all these pieces of information, and I had my conventional Western medical training. I'm an MD. I'm going to keep saying that because people are questioning that. I had all of that, right? And I really wanted to be able to put the pieces together, not just for me, but for others, because everyone was suffering just as much as I was. So finally, in 2009 is when I started my practices, Center Spring MD, and I started them with the intention of only treating women and children, because one of the fundamental concepts of Chinese medicine or Eastern medicine is that you don't treat women and children separately. They're actually a unit. So the health of one is very much connected to the health of the other and vice versa. And that's the only way that you could keep both where they needed to be. So that's how we started. In 2009, I walked into this brand new practice. I thought it would be a hobby, a consult practice. I was still working in the emergency room and began seeing a patient here and a patient there. It was brand new at the time. So I would work. Remember back then, there was no mentorship in integrative medicine or holistic medicine, right? This was totally paving the way. It was new territory. No one held your hand and said, oh, here's a protocol for this or a protocol for that. This was me literally like looking at pathways, looking at physiology, really working one patient at a time, trying to understand what was going on with them. There were nights that I would come home at 10 and 10:30 and I'd only seen two patients because it took me that much time to put all of it together. Well, fast forward, obviously, I started to understand things more. I continued to learn and learn and learn. I continued to expand my own personal training, and more resources became available too, right? We have the Institute of Functional Medicine, which evolved in that time period as well. But I'm still seeing patients. And now, fast forward, we're at 15 years practicing at Center Spring MD. We have seen collectively, we're a team, we've seen probably close to 35, 40,000 patients as a team. We have 2 locations here in the Atlanta area, and then a pretty big virtual platform. So all of that I tell you to help you understand that what I write about in this book, it's based on real people and real stories and real patients and their experiences of using the East-West method, of merging the best of Eastern and Western medicine together to get answers, really looking at the body holistically. Because here's what's happening conventionally, right? You may have an OBGYN who focuses on GYN, but they're not talking about gut health and mental health and nutrition and all these other factors. You may have a gastroenterologist that focuses on gut health, but even today, they're not connecting the dots between emotions, inflammation, genetics, and so much more. So the need for everyone, even 20 years later, which is frustrating, but I guess also my mission and my purpose, is that we have to have a system of medicine and we have to have a way that puts all of it together. Puts your physical health, your mental health, your emotional health, all of it, your social health, and even your hormone health all together. And that's what I've done in the Hormone Shift. The Hormone Shift is very much an East meets West approach to hormone balancing. And while we do talk a lot about perimenopause and menopause in here, one of the things that's really resonating with everyone is that there are actually 5 hormone shifts, and they begin as young as 13, and they continue past 70. But what we're doing is we're not talking about hormones unless we're talking about it in the context of getting pregnant or being in full out menopause, right? We're not having these conversations. And so women are kind of walking through year after year, decade after decade, completely unaware of their body chemistry, completely unaware of how things work when it comes to them. And we want to set that record straight. So what we want to do here is really try to understand all the nuances of you and help you come up with a plan that works for you. Now, I do make it easy. We do have a 30-day hormone reset that is a plan that takes into account all these holistic principles, helps you really start this journey of getting your hormones back on track. We actually try to do some customization as well there by helping you find the hormone pattern that could be responsible for the majority of your symptoms. And we put all that together in this plan to help you walk through and see how far you can get. And this is a universal plan, no matter how old you are. So if you're a teenager, if you're in your 20s, if you're in your 30s, this is something any of you can do. And definitely, of course, if you're in perimenopause and menopause. Right now, if you've not bought the book and you buy the book, you can go onto my website and claim your free gift, which is a whole kind of guide on hormone remedies, natural hormone remedies that we've seen work in practice. And the other thing I want to make very clear is that an integrative or holistic approach is not a yes-no approach. It's not a you have to do this and you can't do that. It's a very targeted, nuanced approach, trying to pick and choose the best of multiple systems of medicine together, while also acknowledging that sometimes you need a hormone and sometimes you need a medication, and all of that's okay. It's just that we want to get to what is the right formula for you. So, how many of you have a copy of the Hormone Shift now? Hopefully it's reached folks that have ordered early or at least pre-ordered. So why don't we do this for the next few minutes? Does anyone have questions, specific questions when it comes to hormones, or specific questions when it comes to the book? And we can go ahead and tackle some of these and see if that would be helpful at all. Now I also want to remind you that because because all of this, all of health, right, is a journey. I firmly believe that, by the way. It's not a, hey, do this, you're going to be fine, or hey, do that. I feel like it's very much a journey, and it's a journey of discovery, by the way. It's a journey of discovering ourselves and who we are and what we need, and then it plays into what I've been talking about, the 5 bodies, which is our emotional health, our mental health, our physical health, our spiritual or energetic health, and then our social health, which is sort of the life that we create and the life and the people that we choose to be around. So when we are kind of walking through these different bodies, it's really important to understand that they're connected and that they come together. And one of the things I realize is that, again, there's just a big gaping hole when it comes to helping people understand that connection. So my community, my Superwoman Circle community, is that community where you can ask questions in a little bit more depth. I do a monthly webinar, and then we do a coaching session. We tackle different topics, but more importantly, it's a group of people coming together to really dive into the nuances of some of this information, which I've definitely set forth here in the book, but I know there is so much to talk about. We actually had to cut, honestly, some information. I think originally the manuscript, you're supposed to be right around 300 pages or so, and I think originally I was close to 500 or 600. So there's so much more content, right, that I could talk about and I could approach, but in a book we honestly didn't have the room for. So let's tackle maybe a few of your questions today and see what's on your mind and how you're feeling about the book if you started to read it. And then I would encourage you guys, if you want more and you want more in terms of resources, join my community, join the Superwoman Circle community. And that's the place where, we continue to dig deeper and deeper. All right, I've got my trusty team, and you should know their names because they've been awesome through this book launch. We've got Kate, who never shows her face, but she's managing all things and probably won't show her face today. I've got Manila over here and Lily, so I want to give them a shout out. They have really worked hard during this whole book launch, and so appreciative of all of them. And of course, Lindsay, who keeps going to bat for us over and over again. All right, let's tackle a few of the questions. They're going to call them out to me, and I'm going to try to answer them. How's that? All right, let's go first.
Okay, so first question, can any of these hormone issues cause excessive fine hair growth on your arms and also diffuse hair loss all over your head? I have lost over 60% of my hair density.
All right, I don't know if you heard Lily, but she's talking about the question around hair loss, having a lot of arm hair and then losing a lot of scalp hair. Guys, this is what got me into this field. Hair loss. I'm not trying to be vain, but I had massive amounts of hair, and over the course of my getting sick in my mid to late 20s, literally my hair emptied out. I was down to probably the same, around 30-40% of my original hair. You could see my scalp. I remember patients in the ER would talk to me, and you could literally see right through this area. It is the worst feeling ever. So I'm with you. Yes, there is a very specific hormone pattern associated with that. It is actually high androgens or high DHT. Androgens develop in response to high blood sugar or high insulin levels. They develop in response to stress. So if you're chronically stressed, that's another reason your body chemistry may shift to a higher androgenic state. We see that shift in the PCOS community in particular, and as those women go into menopause, they have a high androgen menopause versus just a low estrogen, low progesterone menopause. So yes, I know exactly what you're going through. You need to get your hormones checked, and again, in the book, we've got the hormones that you need to check, and look and see what those numbers are. You may need an androgen blocker. A natural androgen blocker is something called saw palmetto. I love using that. There's also something called choline, which helps to clean the liver out, and inositol, which regulates blood sugar. And I actually have all 3 of those together in one of my formulas. It's called a hormone helper in my line, East West RX. And that actually has all 3 of them and can, again, start the conversation around helping you to lower your androgen load. If that's not enough, then we turn to some different medications. But that could be a good starting point along with cleaning up your diet for sure. All right, let's take another one. I hope that helps, by the way.
So we have Mary who says, I've been reading the book and it has helped me navigate conversations with my doctors. Thank you.
Good.
But she does mention her gynecologist said she won't prescribe progesterone alone because she needs estrogen to protect uterus. Thoughts?
Okay, let's talk about this. So this is a question about progesterone. Now, again, going back to my personal journey, progesterone saved me. Progesterone is an anti-inflammatory. It lowers cortisol. It's very important for brain health. It actually plays a big role in brain health. Actually, it plays a role in gut health too. So I actually believe in prescribing progesterone, even if you're not prescribing estrogen, because we're not prescribing progesterone for a bleed, right? For you to have a period and all these other things. But here's where the catch is, right? The progesterone prescription has to be very low dose. It can't be the 100 milligrams, 200 milligrams of progesterone. So for example, even right now, a lot of my patients are on 5 milligrams or 10 milligrams of progesterone. Not a ton, because we're not doing it to have this whole issue around bleeding and having a period. We're doing it more for the anti-inflammatory component, for lowering cortisol, for helping cognitive and brain health for sure. So hopefully that helps you with what to do with progesterone. Okay, let's take another one.
I often hear about high cortisol, but what if I'm struggling with low cortisol? What to do?
All right, low cortisol is sort of a sequelae of having high cortisol for too long. Once your cortisol tanks, you're in adrenal fatigue. That is why the first part of the 30-day reset in here is about this concept of repletion, trying to build your energy back up. Because when you have low cortisol, you're typically in stage 3 or even in stage 4 of adrenal exhaustion, right? You're crashed out. And once you crash out like that, the answer has to be to rebuild you. So it's getting the nutrients in that you need, the nourishment in that you need, focusing and prioritizing on sleep, really slowing down a little bit for that period of time. So if you've got low cortisol, you need more protein, you need more fat, you need more B vitamins, you need things like ashwagandha or holy basil, you need things to help you sleep. Again, I lay it all out in the book and in the plan, but that's why low cortisol develops. It's a later stage of adrenal fatigue for sure.
Okay, so we have a question. What's the best way to lower prolactin levels? Also, can stress be a main cause of hormones out of control?
Okay, question is about prolactin. Everyone heard about prolactin before. It's the breastfeeding hormone. So here's the deal with prolactin. If your prolactin levels are high, then we want to make sure they're not coming from the pituitary. Sometimes you are secreting a lot of prolactin because you have something sitting on your pituitary that's overproducing it. But given that, or assuming that that is normal, right, then prolactin levels can also, prolactin is actually an androgen. So it fits into this sort of high androgen profile that we've been talking about. So what do you do for high prolactin? Definitely make sure from an imaging standpoint we're not dealing with something else. Follow and track those levels for sure, and then really follow the anti-androgen or high androgen recommendations that I make in the book. All right, I think we have time for maybe, what, 2 more? Let's do 2 more. So many good questions, guys. And I hope you're loving the book. Hopefully you're liking the book and it's making sense and you really are getting some of the answers you need. I really am hoping everyone's having that aha moment for sure.
Okay, I have a question about PFAS.
Okay, PFAS. You guys have heard of those before? Those are chemicals, right? Definitely endocrine disrupting for sure.
So how do we know if they're in our clothes? What do we do? How do we avoid them basically?
Yeah, so again, the chemical load is something super challenging, right, that we're all dealing with. We think it's a big part, by the way, of the high androgens that we've been talking about today on the live. We feel like they're clogging the liver, so to speak. They're slowing down our capacity to detox, to break things down. So that chemical load, really is something that we have to pay attention to. The first is assessing where you're getting chemicals from. I usually say food is probably the best place to begin. It's something we can control pretty well. So looking at your food quality, I think these are things that are super, super helpful. I would say after food, looking at body care and skincare, that's a big reason why I like to look at brands that have paid attention to kind of the toxic load that they're putting into their products. And then the PFAS, we're getting that from our pots and pans. We can get it from our clothing as well. Definitely can get it from there. But the best way to avoid it is, again, to choose organic fibers if you can. So organic clothes, stay away from a lot of, again, plastic shiny things. You're going to get a higher load there for sure. And then with your pots and pans, you can actually buy PFA free cookware as well. So that's an option as well. So I think the best you can do to lower it, but remember, I would start with the inside. So think food, what you can do to support your liver, your diet. I think those are things that are very tangible and that you could latch onto a little bit more easily. And then the clothing and the fashion industry is just coming into this conversation. Remember, the EWG, the Environmental Working Group, has a lot of great resources as well. So that might be something to check out too. But that hopefully helps you and at least gives you a starting point.
All right, I have a final question.
Yes, final question.
So for someone who's already had breast cancer, can you talk about HRT? Are they a candidate?
Okay, so I posted a video on my Instagram feed yesterday about what you can do if you have breast cancer. How many of you have been diagnosed with breast cancer? I'm just curious how many breast cancer survivors I have on here. It's definitely Breast Cancer Awareness Month, right? We want to talk about it. And it's interesting with breast cancer. So first of all, the plan in the book is going to work for you because it's a holistic plan, and it begins with the general principles of gut health, liver health, nutrition, sleep, stress, emotional health, all of these different things. So I would start there. However, when you're making a decision about hormone replacement therapy, that's where it gets tricky. The conventional literature right now is still where no, it's an absolute no. The tide, however, is shifting. We are seeing newer research reports coming out and saying, hey, is tamoxifen really worth it? Is it really worth shutting women down to this extent where they're miserable, they're depressed, and so much more? And there's a debate, honestly. There's a debate in the literature, there's a debate in the research, and there's some early studies coming out actually suggesting that women, even if they've had breast cancer, may benefit from microdoses of hormones. Again, the word is out on that right now, right? So you're not probably going to have a practitioner that's openly going to be okay with that. We'll see where the research goes and follow that. But in the interim, at least doing the plan in here is the place for you to begin because it is controlling the factors that can work. And if you purchase the book, definitely log in and get your hormone remedy guide because in there I go through all the different hormone patterns and really trying to match it to remedies that we think work and work safely. All right, that's it.
That's it.
Okay, we probably have more questions. Look, we'll jump on live periodically. We'll announce it. Continue to follow me. Let your friends know. And, really want this information in every woman's hand. And that means your teenagers, your 13-year-olds, your 14-year-olds, your 15-year-olds. That means your mothers, if they're in their 60s and 70s. Because here's the deal, guys. No one's checking hormones on them either. And they're actually converting over and storing estrogen metabolites even though they're low estrogen. And then everyone's suddenly shocked when they develop, an estrogen-based or hormone-based disease in their 60s or 70s. There is a reason why we have to track and check these numbers. So I'll jump on more and keep talking. There's so much to talk about. I mean, look, 200 pages got cut, right? So I could talk forever. I feel like I need to talk about how to check your hormones. So maybe I'll do a video on that. And for any of you who want to go deeper and want a community, join the Superwoman Circle. It's drtaz.com/superwoman. It'll take you right there. Join our community, and it's a chance to ask more questions, to meet other women. And there's actually a private Facebook group as well. And then I go in depth into little segments. This month we're talking about adrenal fatigue and cortisol. So for those of you who are asking me a lot of those cortisol questions, you might be interested in that. But having a lot of fun there as well, as we all really want to change how we think about hormones, how we assess them, and how we manage them from the time we hit puberty to the time we're postmenopausal. All right, I hope you guys have a great rest of your day. Stay tuned for any updates, and we'll see you next time. Take care.